Welcome class to Surgical Procedures 1, 1441. This video will be looking at Chapter 10 under the section of classifications and then focusing on the category of suturing instrumentation. I am on page 251 in this lovely book, Surgical Technology for the Surgical Technologist, A Positive Care Approach, 5th edition. So, the main instrumentation we're going to look at are just needle holders for this section. And there are so many out there. We're just going to look at the basics for now. And so, let's get to it. So first of all, your needle holders. Let's talk about the design of them before we talk about their names. And here is an example of one. We used this in a different video when we talked about loading and unloading blades off of the scalpel handles, and that you're supposed to use this to take the blade, or to put the blade on and then to take it off because it's safe instead of handling it with your fingers. So we've seen this before. The reason why we use needle holders to take the blade off and on, other than safety, the reason why this is the chosen instrument is because you're not going to be able to see this on the video, but there's this little like crisscross almost design or pattern within here. Do you see that? Well, you probably don't. But yeah, and so it's designed to have a decent grip on these curved needles so that they don't slip. Okay, so it's the same idea with the loading and the unloading of the blades, to use needle holders so that it doesn't slip and you injure yourself or someone else, or contaminate or put a hole in the field. So I will say that I have seen a practice test question from an exam that was intended to prepare students for their boards, one of those ones that you purchase for the MBS-TSA. And the question was something like, which of the following 4 instruments would you use to load your blade? And the options were like Peon, Alice, Babcock, and Coker. Didn't even mention needle holder. Well, the best choice there would have been the Peon, but I really would rather you guys use this needle holder. And a lot of that has to do with this serration. So, by the way, this thing that I keep pointing at, these crisscross, this, if you touch it, it's kind of rough. These are actually little inserts. I mean, we can't take them off, but that's what they call them. And these are made out of, if I pronounce it correctly, tungsten carbide. And that is a pretty tough material that, scissors are also made of this too. Not all scissors. So how you know if something has those tungsten carbide inserts is it has gold handles, right? I don't know if you can tell in the video, but this is a gold handle. These are a little more pronounced. See how gold that is? Your scissors do that too. So here is a Metz and Baum scissors, and this gold around the rings indicates that the blades are also made with tungsten carbide, and that makes them just last longer and not be damaged as easily as the stainless steel that a lot of other instruments are made out of. So, now getting on to the specifics of what these names are, and it is going to be hard to tell on the video, but when you come to lab, you can definitely fool with these and, you know, figure out what's what. This is a Mayo Hagar, and how you know is that the tips, the jaws, are pretty thick. And so this is a great needle holder for heavier sutures. So here's an example. I don't recall where I got this from. I think it's like, it's a 2-0. And, you know, a 2-0 suture is really, the diameter is really not that big. They're way bigger, but this particular needle, suture needle, is actually rather thick. It is an OS6, which I realize doesn't mean anything to y'all. But that's okay. It's a big, thick needle, therefore you're going to need a heavier needle driver to use with it. okay? If you were to use a less heavy needle driver, like let's just bring out this one, which I'll show you in a little bit what it's called, but see how tiny this is? If you use this to hold this, look how tiny it is compared to this needle. If you use that to sew with, two things are going to happen. Number one, it's already happened. This needle is going to, see how it turns? These jaws are not big enough. See how it's turning like that? It shouldn't do that. These jaws are not big enough for a big needle like this. And in addition to that, as the doctor is trying to put them through tissue, the needle's going to move around just like this. And then also you risk damaging the needle holder as well. So that's why it's so super important that you use the appropriate needle holder for the needle. So also, if you don't have the appropriate needle holder for your needle, your surgeon's gonna think you're incompetent, and you don't want to do that, right? So, and they'll be frustrated too, because it's not what's best for the patient if that needle is wiggling around, right? It could cause damage when they're trying to close a wound. All right, so with this larger needle and these Mayo Hagar heavy needle holders, make sure that you have the appropriate pickup. Every time you hand a surgeon a needle holder with a needle on it, you better be ready to hand them their pickup, because they're going to need this. These are best friends. They hang out together, all right? All the time. So, heavy needle holder, heavy pickup. There are different types of pickups out there that are heavy that you could use. This is just what I have, but this would be, with what I have, this would be appropriate. Now, let's talk about can you use small needles on this? Well, let's explain why you can't do that. So here is a smaller needle. You can barely even see it, really. And then here's that thick needle that I was using earlier. Like, you can just tell that it's, number one, larger, it's thicker. You can barely see this because it's so thin. This is an SH needle, but you're going to learn all this great stuff later. But let's say I use the same Mayo Hagar needle holder, which is a heavy one, for this little tiny SH needle. And that's not going to be appropriate because, yeah, it's strong enough to hold the needle, and the needle's not going to, look, it's not going to move around like that other one did, because this is strong enough to hold it because it's a tiny needle. But what's going to happen is it will bend the needle. That's what's going to happen. Or break the needle, it could. Also, if we're going to use too big of a pickup with these tiny little needles, it just doesn't make sense. There's just not a need. In fact, the pickup's so big that it's not even really holding the needle like I would need it to. It kind of is, but I don't feel like it's secure enough. Look what just happened. So, really important that when you do your setup and you see what needles are going to be used for this case, because you're going to have a pick ticket, case card, whatever you want to call them, you're going to have that's going to let you know what needles you need. And then you can look at the needle and say, okay, well, I'm going to need the Mayo Hagar for this one, the Krylwood for this one, and so on. And just go ahead and mentally prepare yourself. Because yes, you deal a lot with this at the end of a procedure, with the sutures and the needle holders and whatnot, and figuring things out with that. But there's often going to be suturing during the case too. It really depends on what you're doing. So you just need to be prepared mentally. And man, this is another thing that students really struggle with, is being able to tell the difference quickly between different instruments, different needle holders, and then selecting the correct instrumentation to go along with the needles that they're using for their case. So be sure to work on that, all right? So that was the Mayo Hagar heavier needle holder. So this next one here is a little lighter, a little thinner. This is a Krylwood. This is another really common one. As you can see, it's thinner. It's not as heavy. It's also got those tungsten carbide inserts. That's why it's got the gold handles. And for this one, now just guess for a second. Out of the two needles that I just showed you, big one, small one. Which of these needles would be more appropriate for that Krylwood needle holder? Just think about it for a second. Sorry, I wish I could keep that still. Big or small? This SH needle loves a good Krylwood. I have it loaded on here, all right? And speaking of loading, you kind of do like a 3/4 of the way right there, or 2/3 of the way when you're loading this. You'll even have some surgeons that will request that you load it in the middle. If that's what they want you to do, then do it. But for the most part, you can just go ahead and kind of start like in this nice comfortable off to the side place, right? Anyways, that's also important. Because if you have it too far in, the surgeon's not going to be able to take bites. See, this is too far in. The surgeon's not going to be able to take bites of their tissue as easily, and they'll be irritated. And then if you have it right here, like right there, what you're going to do is you're going to damage this area that we call, I guess, technically it's called the eye when we talk about that stuff, but really it's this place where the company has swedged on the suture, and it kind of clamps down to keep that suture there, and it is very easily to break that off, especially on a smaller needle and smaller suture diameter like this. So it's really important that you also have appropriate placement of your needle holder on your needle. Anyways, this is a Krylwood. Your most common needle holders that you'll see at your clinical sites are going to be this Mayo Hagar and this Krylwood. They're going to be in all of your general sets. And you know, general is going to be kind of the basic foundation compared to all the other specialties, and that's where we'll start first. Those are going to be the first setups that we show you and everything, so you'll get real familiar with these real quick. Now, by the way, all needle holders most needle holders come in different sizes as well. So this Mayo Hagar can come in a shorter size or a longer. Same thing with the Krylwood, all right? These DeBakey Cardiovascular needle holders. This one's pretty long, but it also comes in different lengths, and it's also kind of got this tapered end that's thinner. So once again, you don't want to put these look a lot like the Krylwoods to me, to be honest with you, but you don't want to use a heavy needle for this, and you don't want to use a needle that's too light. So I know that I said these like Krylwoods could handle small suture, but they don't need to handle the super small suture. Like so, that's way too small. Can you all see that? That's way too small. Same thing for these. Though these can handle smaller suture, I would say that these aren't really appropriate for this size of needle, but I think there's got to be some that are better out there, right? For cardiovascular with a thinner tip. Anyways, in fact, why don't we move on to these? These actually might be better for that little small needle. Let's bring that needle back. What are these? Let's look at them first. These in particular are long. They come in different sizes, okay? But these are Ryders, R-Y-D-E-R, and they're super, see how small that is? Let me get these DeBakey Cardiovascular ones out. See how much smaller that is? And then it's got this like bump from it tapering in. So these are Ryders. These are great for really small needles like I showed before. And let's go ahead and load our needle. Oh. See? That just seems to fit on that needle a lot better. There's another one I want to show you that could be used for this small of a needle too, instead of the Ryder, and that would be these Castro Viejos. All right, and these are also appropriate. Now, and they come in different lengths. Now, why would a surgeon choose a Castro Viejo over a Rider or vice versa? I don't know. There's a couple different answers out there. Number one, it's personal preference. Number two, a lot of it's going to have to do with where and how they were trained. Not all doctors go to the same school, right? And they have experiences with a lot of other surgeons before they start working on their own. And they will pick up things that they like that work for them. And some surgeons love these Castro Viejos. Some don't, because they don't like the clicky thing, you know? So it's really up to the surgeon. And that's why it's so important to take notes and read case cards and research your cases, your surgeries before you go into them. It's so important that you talk to your preceptors, and because they can give you a lot of knowledge. It may not say anywhere that Dr. So-and-so prefers these Castros over this, but your preceptor is going to be able to say, use the Castros. He likes those. She likes those. They're your friends. Preceptors are our friends. One more, and then that's all we're going to do for this video on basics. But there is this curved one. Now that's funky, right? Why is it curved? Well, it's because it's a Haney needle holder. You're going to see this a lot more in gynecology than really any other specialties, at least with my experience. But it's important to know how to load these. So your placement is still going to be the same, but it's really important that your curve go out, not in, out. And so I'm still going to load it in the same place. But do you see how my tip is out? Or not my tip, well, yeah, it is the tip, but how this is curved. And since this is a heavier needle holder, you would only use it on the heavier suture needles. I did accidentally skip over what we might use, what pickup we might use for this, like Krylwood. It's going to depend on where you are in the body, but let's just say you're working superficially, maybe in the subcuticular layer, and you've got your SH needle and your Krylwood needle holder. Since you are working relatively close to the skin, you might want to have something with teeth, and these Adsons are great for working close to the skin because the skin is very tough tissue. With these more vascular instruments, such as, more delicate instruments, you'll see these a lot in vascular, the Riders and the Castro Viejos. You'll also see them in like maybe plastics or even eyes, because they're holding such small sutures. That's where you'll see these or something similar to these. And these also will come in that titanium, that blue. A lot of times you'll see these in the blue color. But anyways, what pickup would you use for this? Would you use this big old honkin' Ferris Smith that covers the entire needle? It'll never work. If you're dealing with vascular or something, let's just stick with vascular for now, and something delicate, you probably aren't going to want to use anything with teeth. So I definitely wouldn't use that. But I have these nice Geralds, and remember, our Geralds can come with or without teeth, just like a lot of our instruments do. But look how nice and thin these are, and really these are going to be great for a great partner with your Castros or your Riders or anything that's very small like that, okay? So anyways, those are the pickups that you would use for those types of things. Make sure you're getting the appropriate length too. If I'm using something this size, I don't need to use a pickup with it that's this long or that's this short, right? You have something that's close to it. All right, so we talked about pickups, we talked about our needle holders, we talked about different needles. Real quick, let's just discuss how you're supposed to hand it to the surgeon or to the assistant. Sometimes they're sewing at the same time, so you really have to be on your game passing to two different people, but it's fun. When you're loading these, whether you're right or left-handed, we're just going to learn to do stuff with our right. I've learned from having students who are left-handed in the past, like they can pretty much do everything right-handed anyways because they were forced to their whole life. So just start with your right, okay? And you would load this. It's my right hand. And when I want to hand it to my surgeon, I don't want to poke them with this needle, and I don't want to poke myself, and I don't want to poke anybody else because you can hurt them. You can get a bloodborne pathogen from poking yourself with a dirty needle. All kinds of stuff can happen. So what you would do is you would have this out like this, and then you would hand it to the surgeon like that. But maybe, more than likely, most people are right-handed. You're probably going to be putting it in their right hand. So here's my right hand, and then you're going to make sure that they can feel that in the palm of their hand, and then they're going to take it and then start sewing, and then they'll also have their other hand out because you're going to be ready with your appropriate pickup. I lost my pickups, but anyways, here with the appropriate pickup. All right, so be ready, best friends. Pickups and needle holders. Pass it, and then I'm also going to have this ready for them. And sometimes when you're passing it, you have to move this suture out of the way. In fact, I would just get in the habit of doing that because it really sucks if the suture gets caught up in this, and then they're going to grab it, and then it's going to be in the way. They're going to be struggling with the suture, and then they're going to be mad at you. So hold it out and then pass it. Needles are countable items, just like our blades. So we count them at the beginning. We're going to potentially count them in the case. There's different scenarios out there that we'll talk about later. Then you're going to count them again before or when you first start closing, and then you're going to count them again after the skin is closed, okay? So you really need to be able to pick up with these, and we have or keep up with these, and then we have these fun magnet pads that you can use to keep up with them. So don't worry, they're not going to be loose on your table, or they're not supposed to be. So I think that's it on suturing. We'll practice loading and handing them to each other in lab. See you then.